Lou Gehrig's disease, full detailed summary. Lou Gehrig's disease is the common name for amyotrophic lateral sclerosis, or ALS. It's named after baseball legend Lou Gehrig, who was diagnosed in 1939 and brought national attention to it. ***1. What it is. ALS is a progressive neurodegenerative disease that attacks motor neurons, the nerve cells in the brain and spinal cord that control voluntary muscle movement. Amyotrophic means muscles waste away from lack of nerve input. Lateral sclerosis refers to hardening, scarring in the lateral columns of the spinal cord where those neurons degenerate. As motor neurons die, the brain can't initiate and control muscle movement. But ALS doesn't affect senses, thinking, or the ability to see, smell, taste, hear, or touch in most cases. Bladder and bowel function usually remain intact too. ***2. Types. Sporadic ALS, 90–95% of cases. No clear family history or cause. Familial ALS, 5–10% of cases. Inherited, usually autosomal dominant. Over 30 genes linked, most common are _C9 or 72 _SOD1 _TARDBP and _FUS *. 3. Symptoms and progression. Onset is subtle and varies, but follows a relentless progression. Early signs. Muscle twitching fasciculations in arms, legs, shoulder, or tongue. Muscle cramps and stiffness spasticity. Weakness in a limb, tripping, dropping things, slurred speech. Foot drop, or difficulty lifting the front part of the foot. As it progresses, muscle weakness spreads to more body parts. Difficulty speaking, swallowing, chewing, leads to drooling, choking risk. Loss of ability to walk, use hands, hold up head. Respiratory muscle weakness, shortness of breath, especially lying down. Late stage. Most voluntary muscles are paralyzed, including diaphragm. Most people die from respiratory failure, usually 2 to 5 years after symptom onset. About 10% live 10+ years. Physicist Stephen Hawking lived 55 years after diagnosis. What's usually not affected? Cognitive function stays intact until the operator 50% of cases. The other 50% develop mild cognitive behavioral changes, and 10–15% develop frontotemporal dementia. Pain receptors, eye muscles, and bladder bowel control are typically spared until very late. ***4. Cause and risk factors. Exact cause is unknown for sporadic ALS. Current theory. Combo of genetics, environment, and aging. Risk factors. Age 55 to 75, male sex before age 65, military service, smoking, exposure to toxins like lead or pesticides. Athletes and people with high physical activity have been studied, but no definitive link. ***5. Diagnosis. No single test. It's a rule out diagnosis using electromyography (EMG) and nerve conduction studies to test electrical activity. MRI to rule out spinal cord tumors or multiple sclerosis. Blood, urine tests to rule out other diseases. Genetic testing if familial ALS suspected. Neurological exam over time to track progression. Diagnosis often takes 9 to 12 months because early symptoms mimic other conditions. ***6. Treatment and management. There's no cure. Treatment focuses on slowing progression, managing symptoms, and quality of life. Work with a neurologist and ALS multidisciplinary clinic for best care. FDA-approved drugs. 1. Riluzole Rilotic *, glutamate blocker. Extends life by 2 to 3 months on average. Standard dose 50 mg twice daily. 2. Edaravone Radicava *, antioxidant. IV or oral. May slow functional decline till the operator 33% in early stage patients. 3. Tofersen Qalsody * for _SOD1 gene mutation ALS only. Intrathecal injection. 4. Rilivreo AMX0035 *, combination of sodium phenylbutyrate plus taurursodiol. FDA approved 2022, though later studies were mixed. Symptom management. Breathing. Non-invasive ventilation BIPAP, then tracheostomy vent if chosen. Nutrition. Feeding tube PEG when swallowing unsafe. Mobility. Braces, walker, wheelchair, physical therapy. Communication. Speech T.